Have you ever found yourself thinking, do I actually know enough about tongue tie to assess this baby, to talk to this family, to know what should happen next? If you've ever had these thoughts, our newest program, the Confident IBCLC, was created with you in mind. And it's open to anyone who works with babies and families. You don't have to be an IBCLC. This is a 1-hour live, low-cost, high-impact training for anyone working with babies and families who wants more clarity, stronger clinical reasoning, and more confidence around tongue tie and feeding concerns. This masterclass is here to quiet that imposter syndrome that's been whispering in your ear and to remind you that you are capable, qualified, and needed. You can sign up right now at tonguetieexperts.net. The direct link will be in the show notes. Welcome to the Tongue Tie Experts podcast. I'm Lisa Palladino, a registered nurse, midwife, and lactation consultant with over 35 years of experience, and I'm grateful that you're listening today. This podcast is for families impacted by tongue and lip ties and for the professionals who care for them. Whether you're a parent looking for answers or a professional who knows there is more to learn than what many of us were taught in school, you are welcome here. I hope each episode helps you feel a little more informed, a little more grounded, and a little less alone. My own clinical work is centered on infants and breastfeeding, but these conversations often reach beyond infancy because function matters at every age. Together, we'll talk about tongue tie, lip tie, all stages of feeding, oral function, airway, and how we can support families with more clarity, confidence, and compassion. I'm so glad you're here. Let's get into today's episode. Hi, everyone, and welcome back to the Tongue Tie Experts podcast. I'm your host, Lisa Palladino, and today I am joined by Dr. Fatima Montelongo Solís. Dr. Fatima is a pediatric dentist from Mexico City, where she has lived for most of her life. She has been a dentist since 2008 and a pediatric dentist since 2011, and she also holds a master's degree in research and epidemiology. In addition to her dental training, Dr. Fatima is a lactation consultant and tongue tie release provider. Over the past 7 years, she has performed almost 500 release procedures. She started with scissors, and for the last 4 years, she's been using a laser in her practice. About 40% of her work is focused on lactation, tongue tie, oral restrictions, and lip tie release when needed. She works mostly with babies, but also supports children of all ages. She's also a university professor at National Autonomous University of Mexico, one of the most respected and important universities in her country, where she has taught for almost 8 years. Outside of her clinical and teaching work, she loves yoga, nature, travel, history, real-life stories, and spending time with her family. She describes herself as a happy woman, wife, mom, and lifelong learner who truly loves what she does. Welcome, Dr. Fatima. I am so happy to have you here.
Hello. I'm happy to be here too.
And when I read the bio that you sent me, it just stood out to me how happy you actually are, and you exude just a nice feeling. When I met you in person, I felt like, I don't know, you give a nice feeling to people that you're around, if that makes sense. Like your good thoughts and happy feelings are very evident, and it just was really amazing to meet you in person finally at the ICAP conference, right?
Yes, when I met you at ICAP, it was a great opportunity to meet you and all the doctors and IBCLCs and myofunctional chiropractors, all that people that it's in the same channel that I am. I feel like connected, and I was so blessed with that experience.
Yes, I agree. And we meet such wonderful people there, and we learn so much. And I feel like it's validating, like hearing from people that do the same type of work and hearing that they're having the same successes or the same struggles, right? It feels good to know you're not alone in this because, and this is one of the things we're going to talk about, you're pretty alone in this in Mexico, right? There's not too many people doing what you're doing.
And well, nowadays, I don't know the exact number, but we are not a big quantity of professionals that are doing the releases, and neither the part of the rehabilitation. So so it's not so there is no so much knowledge about that, because they show you at school when at dentist school that you release in kids because of the speech, that's it, and you don't keep the the cares with the therapy. So that's why in Mexico we are a small group of professionals, that health professionals that are working on this. And I hope really that it increases, because it's a necessity of everybody, not just because, yeah.
Right. Well, so if it follows what happened where I live, and I was living in New York for most of the time. I was practicing in Staten Island, and there was nobody even talking about tongue tie. And the people who were releasing at the time when I started were people who I had to like talk into it. You know, I had to say, please, can you do this? The baby needs it. You know, I had to talk them into it, explain why it was important, explain the struggles of the babies. And now there's quite a few dentists in the area who do it and who understand the team approach and who understand the need for the pre-care and the aftercare. So there's hope for you. You're a pioneer.
Yes. Yes.
There is hope.
I'm doing right. Yes, I'm doing right. And I have people that are doing right. And I admired your experience. So I read about you, like 35 years of education, families, and health professionals.
Yeah.
That's why the ABCLC, I think, might be one of the first contacts with the family who are known about this problem. And then the story goes on.
Right.
But yes, I do really admire that of the time that you are doing, because it's not easy, because it's about something surgical. And when we are talking about babies, families try not to do invasive, invasive treatments. But when they are aware of that benefits through the life, they say, okay, it's worth it. Something surgical
of course.
now, worth it in the future.
Yeah, non-intervention. You know, that's how I was raised. I'm a midwife, and midwives try not to do anything, right? The least we do, the better. We support natural. And so for a while, way back, I thought tongue tie. I was one of those people that was saying, why would you ever do that to a baby? You know, that was me. So I totally get that. And I think that that's might be why a lot of professionals relate to me, because I'm honest in my experience and I know where they're coming from. So I know how to talk to them about it, because that was me, you know, until I've told my story hundreds of times. I won't go into it now. But in Mexico, I'm just curious, are there a lot of IBCLCs, and do they understand tongue tie treatment? Because that's different in different places.
No, there are IBCLCs. Yes, there are. I don't know the number really, but there are. I know a lot and very well prepared. Okay, but in the IBCLC, as I know, maybe I'm wrong, but they don't have the preparation for tongue tie understanding. So I know some IBCLCs or lactation consultants without the international paper that are doing the work, and but they are so little group of women that know about the topic.
So
Yes.
like here, you can go to a lactation consultant and it can be missed, right?
Yes,
Like that's
it can be
here.
missed.
Yeah.
Yes, it happens in Mexico too.
Yeah. Okay. Well, we have a lot of work to do, but we're getting there, right? We're getting there.
Yes, we're getting, yes.
And the idea of, like, I just was curious, because you're in this environment and weren't trained in school, how did you come to this work with helping babies? Tell me about that.
Yes, because of the arrival of my daughter. I have a daughter, so that my experience is the same age of almost the same age of my daughter. She was not a tongue tied, but I really, when I was with other moms, because I was connected with other moms, I saw the importance to know about the topic. So I started studying, and then I'm a surgeon since I came from dentist school, because we do a lot of surgery, many types of surgery, but not in babies, really not in babies. So little by little, with the pediatrician of my daughter, I was working along with her. I was working with her, so I started to understand a lot of the lactation, because I was prepared before my baby was born. I went with she is a doula. Yes, she's a doula, and here in Mexico. So I started to enter in the world of the lactation and babies, and that's why I get interested in all that. And I say, like, oh my God, I should know about this. And then life give me the patience.
Yes.
Well,
yeah.
yes.
Once you say I understand, it comes to you, right? I remember once talking to, you know Dr. Scott Siegel?
Yes,
right?
I know.
So he was
ICAP.
Yeah, he was my mentor. He's one of the pioneers, right? And
yes,
I remember having a conversation, because in the beginning, every time I got a baby, I would call him and talk about it. And I made a lot of trips to his office with babies to learn more and watch what he was doing. And because I have this rule, I don't recommend anyone who I haven't seen them do the work, right? Like, I want to know what I'm talking about, either on me, my family, a patient I'm with.
Me too.
So I used to travel, go into the city and watch him and learn from him. And one day I called him and I said, every baby I have, everybody is sending me. All of a sudden, I'm getting all of the tongue-tied babies. Everybody's referring to me. I don't know. Should I be doing this? At the time I said, I don't understand everything about it. I don't know that much yet. And he said, Lisa, if not you, who? You know more than anyone else, and you're learning and you're helping them, and we're working together to learn. So that was like what gave me the confidence. But it sounds like that's similar to what happened to you. All of a sudden, they just show up, right? Word of mouth. Moms talk to each other. Never advertise. I never advertised in the beginning.
No, neither do I. At the beginning, I didn't want to.
Right.
Because you don't feel very sure about your early knowledge.
Right.
But the demand of the problems is there.
Yeah.
So that's why it's like magnetical. So you know about that, and then families go to you, because every surgery, if I am thinking about a release, I get in contact, yes with the pediatrician, because I'm not a doctor, like you will say in the States. I don't know. I'm a dentist.
Right.
So here in Mexico, we are prepared just as dentists, not as a medic with a medical school. So every time that I'm gonna practice a release, I contact first the pediatrician, and then I talk about the problem, and that has guided me to people that then they search for me again, because they are seeing the problems, and they are now aware, because of the experience of the release, how babies do very well with the lactation and all that. And that is how it started to be more and more and more common. But that contact that I have with the pediatrician has been very important to me, because that give me a lot of security to work with the babies of days of was born, or weeks, or 1 month, 2 months. I work with every age of the baby, every age, really. I feel very accomplished, because I work with a pediatrician. If pediatrician says no, I don't work.
Many professionals were never taught how to fully assess tongue tie, and families are often left trying to reach their breastfeeding goals without the support they actually need. If feeding feels harder than it should, I don't want you to be alone. I wrote Tongue Tie for Parents to help you understand what's happening and how to move forward with a clear, thoughtful approach. It's the same guidance I would give you if you were sitting with me in my office. It takes a holistic, functional view, guiding you through what to look for, how to think about next steps, and what actually helps. Available now on Amazon. Link is in the show notes. And
that's the way I work.
Yeah. Have you gotten a lot of pushback from pediatricians?
Yes, I have. Not a lot, because I have tried to explain them,
So you're
not to
teaching
convince
them. You're teaching
yes,
them.
but
yeah.
Yes, I'm teaching them. I'm sharing what I know, but I have been with pediatricians that say, no, I don't think that's a thing that should be done. No, I say no. So what I tell the patient is, it's okay. Your pediatrician said no. So you have the option to stay with that, and it's okay, because you need to be with peace that you take the right decision, or you can try and ask for a second opinion. But I really give the freedom of the decision to the families. I never insist. My work is not to convince. My work is to inform.
Oh, I love that.
The pediatrician, yes. So the pediatrician, most of the pediatrician I've getting in contact because of this situation notice that. So that's why I have a like the credibility.
So you know what? You say things that I say all the time. I think the most important thing we can do, no matter what our role is informing and educating parents and helping them to make an educated decision and trusting them, right? Trusting them that they're going to make the decision that feels right for their baby at that moment, right? Because that's going to keep us all safe, right? You're keeping yourself safe by doing that. We're not pushing the parents to do something that they don't feel ready for, because that could backfire, right?
No.
Yeah. And especially with all of the bad press about tongue tie releases, and that, how lactation consultants, all they ever want to do is tongue tie. That's not true. We know that's not true. We do so much more than tongue tie. But so we have to be even more careful with how we are speaking to parents, what we say, our language, our words matter, right? In our education.
Yeah, the approach.
Yeah.
That approach should be gently, but firm, but with information. So, see, if you decide you're going to do the release, that is the panorama, or the coming facts that are gonna be with you. If you decide not to, that is the other,
right.
like the other way.
Right.
So you decide with your pediatrician. Here in Mexico, a pediatric dentist do the releases when it's prepared, and the pediatric dentist want to. There are some pediatric surgeons that do it, and otorhinolaryngologists in medical. Like in the
in the hospital medical practices, right?
Yes.
Yeah, here too.
Yes,
yeah.
Most of the time. I don't want to generalize, but I want to mention the health professionals that are doing the releases here in Mexico that I know that are that have the permission to do it.
Right. So, so it's very similar to what is here. There's just less, and I don't want to generalize, but there's less communication and acceptance between dentists and pediatricians where I am. And a lot of people talk about that. And we heard a lot about that in ICAP, right? That it's harder. Like the pediatrician seems to be the challenge to get on board, right?
Yes, the pusher.
Yeah. And that has a lot to do with their professional association and the messaging they put out, not really understanding, not looking at the research that has been done outside of pediatrics about tongue tie. And they just, it's a challenge, but we're getting there. I think we're like moving.
Yes.
And we're moving faster in better directions, in my opinion.
Yes. And I'm not tired about that, because I know it's a way. Right. It's like, no, I don't want to try with the pediatrician. No, I know that's the way to talk with the pediatrician and explain and know what is its opinion. And then we go or we don't go. But most of the pediatrician I've get in contact because of this topic and has understand the importance of this and has the experience on how babies goes very well with their recovery and with all the advantages they have in their life. They have really successful, very successful patient life. Yeah, let's say that. I don't know how to say it in English, but they are very pediatrician, very popular, because the people know that if I go with that pediatrician, I know that I will have holistic, let's say an holistic.
Right. Yeah, they're more holistic. Here we call them crunchy. We say the crunchy moms go to certain pediatricians who listen to them and will take their desires into account, not just cookie cutter. This is what we're doing, and we're not doing that, and like that, right?
Yes, I want to say try to establish what am I talking about holistic, because holistic sometimes sounds like magic, and no. I'm trying like the body, the revise the whole body, the mouth, the muscles, and all that things that are not like I'm a dentist. I just see cavities and da. Right. No, I try to see the baby in the whole body, let's say.
Right. Because that's the best definition
about that.
Yeah, best definition of holistic. We're looking at the whole picture, and not just the baby's mouth, not just the baby, but the mother and the feeding and how it's all working together, right? Because you can't evaluate for tongue tie function or tongue function without seeing how that baby feeds. And most of the time that involves a mom.
And there's a lot to know about that.
Yeah.
I think I'm preparing myself to know more, but every time I study, I like, oh my God, I need to know more, the fascia, and I mean, it's a lot. And I feel very sure what I'm doing. I feel very sure of my treatments. I'm not doubting. Yeah, I'm not.
And you're having good results, which is
yes.
And families are happy. That's what matters.
Families, right? Most of them are happy. The ones that don't want to be happy, it's okay. Everybody decides.
It's true. Some people are happy no matter what you do, and some people aren't happy no matter what you do. But
Yes.
so we talk about what happens before and after, and you just mentioned fascia. Are you working along with any type of what we call body workers, any manual therapists?
Here in Mexico, like chiropractors or chiropractors, we work with a physiotherapist.
Okay.
Not that like chiropractor baby. No, like physio. In my case, I'm working with myofunctional and with physiotherapists that are prepared to care for babies. Not all of the physiotherapists are have the training to work with babies. Just the ones that study for that.
Right.
Yes,
so I think physiotherapists in Mexico is about the same as what we would consider physical therapists or occupational therapists, right?
Like physical, not occupational, like physical. Yes, the occupational is more like a Mayo, but with another preparation. So certifications that
right. It's all different names, but
yes, but it's the same. They most of them or many of them has the certification from the States.
Okay. Oh, that's cool.
Yeah.
And then we also have craniosacral therapists. I'm sure you have some people there doing craniosacral therapy too.
I don't. If there are somebody in Mexico in your community that is a cranio, I would love to meet.
Oh, great!
Because I don't have any here in Mexico that I know.
Let's put the word out. We need some. Yes, we need some CST providers in Mexico City.
Please, if somebody of the community wants to get close,
I love to be able to recommend different types of providers because different families feel comfortable with different types of providers, and different babies need different therapies.
Necessities,
for sure. But also what I think might be best for a baby isn't going to work if the family doesn't like that, right?
Yes, exactly.
Or can't afford it, or it's too far away from them or whatever. So I always like to I'm very blessed that I have a list, now I do.
And
not in the beginning, but now I do.
Yes. Here in Mexico, I saw that it's affordable to have a physiotherapist or myofunctional. And in the States, as I work with all the people that were in there, that's one of the things that told me here in the States it's very expensive to have that kind of care. Yeah. So maybe it's something that is not taken because of the cost. And here in Mexico, really, the people that is in Mexico should know that we are blessed that we can have that kind of advantages of that therapy affordable.
That's great.
Yes.
Yeah. That's great.
And very nice people, very prepared people that can give you that kind of service.
Right. So there are similarities and differences in this care in different places, but we are all looking for the same thing. We all want to help babies breastfeed and breathe while they're breastfeeding, and mamas be comfortable and everything working for them. And then when they're babies, and then adding the feeding and hoping that goes well when they start solids, and then the speech later on, all the things at different levels, right?
So, other thing that the moms should have, all mom should have, it's at least a lactation consultant. If she can have an IBCLC, it's much, much better because of the preparation. But I mean, that's like a dream. But in my opinion, that should happen with every mom, every family, because it's very important to have that in that moment of the birth and all the things that come as a mom, that you should have the information. So I am a mom. So I had all that, and I was very blessed and very informed. And I feel very secure of all the things that I decided to do or decided not to do, because I have the information from many professionals that work with babies and with moms.
Right. Yeah. And you had the support of people who knew more than you did at the time, which is so
Yes,
important,
exactly.
right? And you know what? Here, what happens is IBCLCs or lactation consultants in general don't get the respect. We don't get the respect we deserve. So people who are doctors are not recommending lactation consultants. And mostly they don't understand our role, right? They don't know what they don't know, if that makes sense. And
Yes,
that's
yes.
my theory. And they think it's like an extra, like, an extra thing.
Yes, because the sensation of feeling that I know everything because I'm this, that, or those, and I don't need to know more because I have an degree,
Right.
so I don't need to know anymore.
Right.
So that's a failure.
Yeah.
I really, because I have learned a lot of people that works with babies that are not doctors or dentists or whatever specialty that a baby needs to have. So I've been open to that, and I think that's one of my ways to work right now, so comfortable with what I'm doing, because I receive the information of many women mainly, many
Right.
about topics of babies that I didn't have idea of that.
Right.
So I was being educated by them.
So one of the points you're making is that we don't learn all of this in medical education, and we learn separately, right? Like, as a dentist, you didn't learn with doctors or lactation consultants or nurses or midwives. You learned just as what you needed to know to be a dentist. And the doctors learn what they need to know to be a doctor. And I learned, I was a nurse first, then a midwife, then a lactation consultant. Now I'm a tongue-tie experts podcast producer. So you learn from different people what you need to know. I had to learn marketing from a marketer, right? Like, you can't just know all the things, right? So
that's one of the things that I like from ICAP.
Yes.
They are a lot of people of different knowledge, but having dinner, working with other, and I love that. I really recommend in Mexico, if some doctor, some dentist is doing this about the releaser, is a release provider, they should go to ICAP, because you learn a lot.
Yes.
But you should be open to that communication.
And there's interdisciplinary learning and no hierarchy. Nobody is more important than the other.
No.
And I've never seen that before. That's my favorite thing about ICAP, right? That nobody on the team for tongue tie is more important than the other person. Everybody's respected. And everybody's opinions are listened to. We don't always agree on everything, right? Like,
yes, not always.
There are different ways of doing things in different countries, right? So if we started talking about your procedure, it might be a little different than, somebody in Australia, right? I mean, it's all different.
Canada.
Right. But we respect each other and listen to each other and realize the differences matter, but the differences also unite us because we learn a little bit from the different ways things are done.
Yes.
Yeah.
Like in the time I've learned, like Dr. Shurak, I don't know how does it pronounce Shurak, that the therapy is much more important than the release. Yes. I agree with him.
Yeah.
I really agree with him. Mm-hmm. And I think the most thing that I most agree of every agrees existed is the diagnosis is most important.
Yes.
And then the therapy, the pre and then the post.
Yeah.
And at the end, the release, it's very important, but it does not work without any of these two.
Right.
So I agree with him. I was reading in like, oh my God, yes, I do agree.
Yeah, and Dr. Siegel has said that many times, that his part is the easy part. That's what he says. He's like,
yes,
the release
is
the easy part. That being said, if it's not done right, it can be a disaster. It could not work. It could either be released too much or not enough, and then families are left feeling like they got it taken care of and it didn't help when they really didn't get it taken care of properly. So your role is really important too, and doing this well, is important. And if you're being recommended and families love you and other doctors are sending patients to you must be doing an amazing job. So thank you for that.
No, I'm so blessed because of this life that I'm living, really.
Mm-hmm. Yeah, it's cool. It's really cool because you're changing lives. You're affecting people's lives, right? Starting from the beginning. It's wonderful.
Yes, starting from the beginning. Yes, exactly.
And you're doing it in a place where it's a little bit more behind what we're doing here. So you are a pioneer there, and I commend you for that too. I think you're the second person I've met, I think, from Mexico. Right. So
yes, I think you will meet more.
I hope
you
so.
will see that.
I hope
yes,
so.
I know you will meet more because
we need a conference down there. Let's do a conference.
Yeah, of course. Yeah.
Travel is hard, but we could try it.
I feel comfortable with that. I have a lot of cases. Yeah, most of them are successfully accomplished.
Okay. So Dr. Fatima, is there anything that we didn't hit on today that you want our audience to know? Anything specific? How could we find you? You have a website?
I have social media.
Okay.
Yeah, I have social media like
Instagram?
Fatima Odontopediatra. Okay. It's my working social media.
Okay, so I'll put that in the show notes so people can find you. Hopefully a lot of people from Mexico will listen and be networking with you over there.
I will share it in my community. I will share it with my community. Yes, it's a community that is growing. I'm not so active, but I have a community that is interested in what I'm doing. So I will share it. So
excellent.
They know more about what's happening in the world, not just in Mexico.
Yes, excellent. So thank you. Thank you so much. I know you're very busy, and I really appreciate you giving this time with us today. I hope my audience enjoyed meeting you as much as I did.
I enjoy meeting you, and I'm talking to you right now. I meet you there, and then talking to you it's such a pleasure for me. Really, really, I'm so excited to talk with you and with your community and with my community.
Thank you.
Everybody that wants to listen.
Yes. This podcast is meant for education and conversation only. It is not medical advice and does not replace formal education, professional training, or individualized care from a qualified healthcare provider. Always seek appropriate guidance for individual concerns. The views and opinions shared by our guests are their own and do not necessarily reflect those of the host or tongue tie experts. Have you ever found yourself thinking, do I actually know enough about tongue tie to assess this baby, to talk to this family, to know what should happen next? If you've ever had these thoughts, our newest program, The Confident IBCLC, was created with you in mind. And it's open to anyone who works with babies and families. You don't have to be an IBCLC. This is a 1-hour live, low-cost, high-impact training for anyone working with babies and families who wants more clarity, stronger clinical reasoning, and more confidence around tongue tie and feeding concerns. This masterclass is here to quiet that imposter syndrome that's been whispering in your ear, and to remind you that you are capable, qualified, and needed. You can sign up right now at tonguetieexperts.net. The direct link will be in the show notes.